In Nigeria, violence is very high. On previous studies that have been conducted among women, a few among men, and almost nothing among couples. So our study is unique because it's couple-based, meaning that it's going to be done among husband and wife. And two, we're looking at 3 different interventions. The first one is gender socialization. The second is financial literacy. And the third is family planning literacy. And we hope at the end of this, women's bargaining power will be increased, dominating power of men will be reduced, and then we generate equality in decision making, and at the end of the day, reduce violence among husbands and wives.
Research done in Papua New Guinea shows there's an estimated 80% intimate partner violence rate. Now, currently there are prevention programs taking place in Papua New Guinea, but they're mostly focused on addressing the symptoms of violence rather than looking at the root drivers. So Oxfam has been implementing a prevention program looking at the root drivers and is hoping to do an in-depth evaluation of this program, which we can then advocate for replication and uptake by other agencies, so that we're thereby creating a safer environment for children to grow up in.
Globally, a lot of resources have been spent on setting up hospital-based crisis centers to respond to the issue of violence against women. But very few research studies exist on really evaluating these projects. So our study fills in a gap and is unique because it will actually carry out an evaluation of 11 hospital-based centers in Mumbai in India. What's unique about the study is that we will bring together voices of survivors of violence as well as doctors and nurses who responded to these victims of violence against women. The impact that it's going to create is that it's going to enable health ministries to really recognize how much of the economic resources to be spent at different levels of the health system. And that is something that I'm passionate about, which is bringing about a change in how health systems respond to violence.
There's been massive progress in empowering women in Bangladesh economically. Nonetheless, the acceptability of violence between couples, both among women and among men, has remained very high. We will test a media campaign in Bangladesh that has been found effective in other settings. For the first time, we will vary both the messages being sent as well as the dissemination outlet. And we will target either husbands alone, husbands and wives, or communities as a whole. Our intervention will allow us to understand how to best design media campaigns that can change attitudes in different settings in the future.
Physicians for Human Rights has developed Medicapt, a mobile app that allows clinicians to document forensic medical evidence of sexual violence to support prosecutions in Kenya and the Democratic Republic of the Congo. No other tool like this exists to capture forensic medical evidence. Our research will evaluate the efficacy of the app, the experience of the survivors in the clinic and their access to justice, and the ability for health facilities to be able to capture statistics on sexual and gender-based violence. So many times survivors don't come forward to report the abuse they've endured, but for those survivors who do dare to come forward because they want their day in court, their cases often fail because there's a lack of adequate evidence to support their allegations. So we developed this intervention to be able to help those courageous survivors actually win when they seek access to justice.
What about the women who don't come out and report what has happened to them? There are a lot of cultural barriers that prevent women from coming out and reporting violence that has happened against them. And with our project, we are trying to address exactly this problem. We are setting up women's help desks in the building complex of 120 police stations in the state of Madhya Pradesh in India, with the hope that these act as a last mile resort to women who do not have the ability to travel to cities or to faraway places to talk about their problems. By setting up these help desks, we are hoping to see some increase in reporting from women who face crimes against them, and we are hoping that this encourages more women like them to come out and talk about their problems.